I don't need. I don't think I need a microphone. Usually I'm too loud. People tell me to shut up. Anyway, so most of you guys already know me. I'm Jason with Doctors Without Walls, Santa Barbara Street Medicine. We have our communications team here with us. Just to introduce you, you guys want to introduce yourselves?
Yeah, my name's Trevor. I go to UCSB. I'm in my last year there, and I'm the communications coordinator of Doctors Without Walls.
I'm Lauren. I'm just graduated from UCSB, and I'm a communications intern with Doctors Without Walls.
Hi, my name is Ryan Wynn. I used to be the communications coordinator for Doctors Without Walls. I'm now a first-year medical student at the Western University College of Osteopathic Medicine and Pacific, and actually skipped an anatomy lab to come here today.
So thank you guys for coming. This is not a very sexy topic, and I know that a lot of the other people that are also offering workshops at this time, they're probably a lot more interesting. But just to give you an idea of what communications is, the communications team was born at Doctors Without Walls when our founder, Dr. Mimi Doohan, said, we have the best non-for-profit that nobody's ever heard of. And that's what we're going to talk about. So first of all, this is our comms team. We use comms for short. And a lot of the tricks that we're going to be talking about are things that I've learned working for other humanitarian aid organizations on how to really work with communications, how to craft a message, how to be effective in the delivery of your message, and how to go about that process. This is our communications team. For those of you that were at our previous workshop, we talked about volunteers and the way we pay volunteers. This was one of our, every couple months we go out paddleboarding. There's this big body of salt water near the Santa Barbara called the Pacific. Slightly less salty than the body of salt water here, but this is us. Okay, so what are we going to do? We're going to talk a little bit about what a communications team is and what does such a team do. We're going to talk a lot about message, crafting a message, maintaining a message, managing public perception, goals of your message, about how to size up your audience and what are you trying to do with your message. Are you trying to recruit volunteers? Are you trying to recruit donors and get and do fundraising? Are you doing this as a form of advocacy? Because all of us have this unique opportunity to be with the patient population, our homeless friends, and maybe we want to make sure that we get those issues and give a voice and a vector for the communities that we're serving. How to create an ask. When we engage in communications as part of an advocacy organization, we're not just there to lecture. We're there to end in an ask. We're asking our audience to do something. Either our audience is going to donate money, donate time. Our audience is going to provide political will to create change. We're going to have an ask. Understanding different communication medias. Part of this is, and if you don't have young people as part of your organization, find some, because these guys here are the ones that know how to set up websites, how to use Facebook, how to use Twitter, and that's how people are communicating now. So if all you have is a paper newsletter and are going around giving public announcements, then chances are you're not reaching out to the audience that you could be. We're going to talk very briefly about talking to journalists, because journalists are always our potential friends, and the media is out there, and there's some tricks you can keep up your sleeve so that when you do talk to journalists, you can have a message. They want the story, we have a message. We're able to have a symbiotic relationship, and there's some tricks to doing that. Informing the public and policymakers. I talked briefly to Pamela. She's unfortunately or fortunately, she's with the governor right now and couldn't come to this presentation because I said we'd love to hear your tips on how to talk to politicians and influence policy. And then using the comms team as a resource for your organization. So what is communication? Communication is the art of transmission, the exchange of thoughts, message, information through speech, signals, writing, or behavior. It's the art and the technique of using words effectively to impart information or ideas. And all of us that work with the homeless community, we have a lot of information that the public doesn't know but needs to know. And we have a lot of ideas that the public doesn't know but needs to know. And we need to be effective at getting that information from within our organization out into the great ether and beyond. So what is a communications team? We always talk about a comms team. What exactly is this communications team? Once you establish your comms team, it makes it very easy for the rest of the organization. All public speaking events go through the comms team. So that way, whenever any of the volunteers or any of your members of the organization, you get approached by a Rotary Club, by a church, by a school, and they say, hey, we think what you're doing with the homeless is really great, can you come talk to us? Then you route them through the communications team. The communications team will find a speaker that is appropriate for whatever that public speaking engagement is, and will give them templated PowerPoint slides to help that speaker give the message that's appropriate for that audience. We'll talk about that. Coordinated press releases, media relations, respond to negative press. Okay, a lot of times when there's a homeless death, it becomes very high press. A reporter might contact your organization, say, does your organization, do they want to comment? Route it through the communications team. Let the communications team find the appropriate person to respond. If it's a medical issue, maybe we can find one of our medical people and have a statement that we can prepare. If it's a financial issue, maybe a member of the administrative staff. But the important thing is all media things come through the comms team, and it's a way for us as an organization to stay on message. Managing the website, managing a Facebook page, managing a newsletter. Lauren's going to tell us a lot about a newsletter and how we can use a newsletter not only to keep people within our organization informed, but also as a tool of advocacy so that we can engage in that sacred act of témoignage and bear witness to the communities that we're serving. It gives an opportunity to act as a voice for the organization, manage all affairs related to public perception. Yes, sir.
You used the word I don't know.
Oh, I'm sorry. I used that word a couple days ago. Témoignage is a French word, and they teach it with Doctors Without Borders, and it's the act of bearing witness. So a lot of times we as a grassroots organization, we believe in providing medical care to the highest need population. We believe in providing education to the next generation of humanitarian healers. And we believe in advocacy, that we need to speak out and let the world know what it is we're seeing and make sure that policy is pushed in a direction that will overall improve the quality of health in our own community. Excellent question. So we're going to want to keep members in our organization informed. We want to act as an instrument to recruit volunteers, donors, and public awareness, and we want to engage in political lobbying. Anything related to public image, branding things, anything goes through the comms team. The goal is let doctors be doctors, let social workers be social workers, and let all things that are involved in spin and advertising and public relations go through the comms team, and make sure that people that have an interest in that or have a background in that who are with your organization are part of that communications team. So some public speaking tips. One of the things that our comms team goes all over the state of California, and we talk about homelessness as an issue, and we have all public requests that come through our comms team. There you can see all three of them there given their shtick with passion. I love it. We created a templated PowerPoint which has key images, our mission statement, our financial transparent information, everything. Like, just say someone just started volunteering with their organization 3 weeks ago, and one of their friends asked them, hey, can you come talk to our church about the homeless? We give them that PowerPoint and they say, now you can change it and make it personal. And that way, they have all the tools that they need to represent the organization with transparency and with all the information they have right at their tools. And that's a service that we as a communications team offers people in our own organization. I always say about public speaking, I'm a recovering academic, and when I was an academic, I used to love numbers and graphs, and I think numbers are sexy, and I thought that, some of those presentations today were just extraordinary. I can't wait to get my hands on that data. But when we're going in public speaking, we're in the process of advocacy, and we need to find that sweet balance between narrative and statistics, right? We want to talk to our donors, show them that we are financially transparent, that we're responsible, that we're spending the donated money effectively, but at the same time, we want to show them images of people that we've helped. We want to give them narratives, stories, because they're going to remember the stories, but they're going to donate their money based on the statistics. So you got to find that balance, and sometimes, depending on who you're talking to, you're going to balance your presentation more in the direction of narrative or more in the direction of statistics. You always want to know your audience, research your audience, and tailor your presentation to your audience. Pick an appropriate speaker for your audience. If you're asked to give grand rounds at a medical center, find a physician. Don't have one of your secretaries that does filing in the basement give that talk. One time we got asked to give a talk. There was a group of very wealthy women that had a jewelry show in one of their houses. And we had Ryan, who had just gotten into medical school, give that talk, and they thought he was the cutest thing since sliced bread, and they thought, oh my gosh, this is the future of medicine, and none of them bought jewelry, they all donated to our organization. So find the right person to speak to your audience. And this is a little advocacy thing. They're going to say, hey, you know, we are a group of social workers. We really want you to come out and talk to us. Always give them what they ask for and give them what they should have asked for. Right? So you always want to give them what it is they want, but you also you want to give them what they should know. And that's, you should always do it. Educate, entertain, inspire. Always end in an ask. This is not like a college class. You're giving a presentation. At the end of your presentation, you're asking something of your audience. You're going to end in an ask. You're going to say, I want you to donate money. I want you to donate socks. I want you to come out and volunteer with us. I want you to write to your congressman and say that we need more funding for this. Always end in an ask. Once you've got your audience, they're all excited to get involved, give them something to get involved. Journalist, okay? Journalism tips, again, anytime, and we tell this to all of the people in our organization, when you get approached by a journalist, we love talking to reporters. It's fun. But make sure it goes through the comms team, and we gotta make sure that the right person is talking to the reporter. You're always on record. So when that journalist turns their microphone off and says, okay, so really, off the record, what do you really think about that? No. Don't do that. You're always on record. Journalists are potential friends, okay? You might think that they're all evil and all they want to do is smear bad press, but the reality is they're looking for a story. And we're in a position where we can give them a story. And you want to make sure that you have a message. You're working with this journal, and the journalists know this language. So when journalists come to me, they say, hey, there were 3 homeless deaths this month. Do you want to comment? I say, you know what? I would really love to comment. I'm going to bring a couple of my interns. We're going to do an interview. Our message is to talk about the barriers of access to healthcare. We're going to help you develop the story. I'm going to get you sound bites from these 4 people in the community. Okay? And now we have a nice collaborative relationship where journalists get the story, we get our message of advocacy out, and ultimately there should be some political advocacy that the patient population we're serving gets better care. Maintain relationships with journalists. Now we've gotten to the point that there's a few newspapers in Santa Barbara. We're their go-to source about anything related to public health, healthcare, and the homeless. They always, Doctors Without Walls makes a statement. Sound bites. Sound bites are important because a lot of us especially us who are doctors who like using a lot of Latin and Greek words, you want to say something that's catchy, that's sexy, that's cool, and that's a sound bite. And people in the entertainment world and in the advertising world know what a sound bite is. And we're going to give you an example of a sound bite. Because a sound bite is what you walk away and you remember, like, oh yeah, that's kind of snazzy. Bridging. Sometimes you might talk to journalists that disagree with you. And they're going to try to get you off message and get you to say something they can quote you. Okay? Don't let them do that. Bridge the conversation. I'm so glad you asked that question. The real issue is this. So when a journalist says, don't you think all these people are lazy? You know what? I'm so glad you asked the question about that, because the reality is that there's an overrepresentation of mental health and substance abuse in our community, and we need to make sure that we give them the resources that they need so that they can be contributing members of our society. Okay? Bridge it back to your message. They want to take you to the bad place. Don't let them, cut them off, take it back to the sweet place. Sometimes, and this gets into more sort of sophisticated rhetoric, you can have a soft bridge or a hard bridge. I know Your Honor probably sees this in the courtroom all the time, so I'm not giving you anything you don't already know, because I think they teach this at law school, but I'm just a doctor, I wouldn't know.
I just didn't know what to call it.
Yeah, sometimes they'll ask you a question and I'll look them in the eye and say, you know what, you're just flat out asking the wrong question. The real question is this. So, and always be able to refer them to your website, a fact sheet, or another resource, because after talking to you, they may need a little information, and you don't want them to make that up, because now they're typing, trying to meet their deadline. So, go to our website, there's a fact sheet on our website, just so that they can fill stuff in. Okay, this is one of my favorite sound bites by one of my favorite people, Jim Withers. The essence of healthcare is going to where people are. I mean, that just sounds cool. Right? Either physically or even more importantly, spiritually and emotionally, when they're shown that they matter, when that really sinks in, then hope grows and amazing things happen. I kind of got the tingles right there. I mean, that's a soundbite. You want something that's short, that's concise, that's quotable. That's something that they're going to put in bold in their newspaper article. Okay? McNamara, never answer the question the journalist asked you, only answer the question you wanted them to ask you. So, there you have it. Talking to politicians. So at some point you might end up talking to your city council, your county board of supervisors, your state government, even your federal government. And when you do that, you have an opportunity to really sway policy. And always be respectful of their time, and make sure your ask is very short and very concise. Be able to do it in 20 seconds. We as long-winded physicians who like to talk about, so say a lot but say very little, no. You want it to be nice and concise, 20 seconds. Always ask, Congressman so-and-so, I'm a voter, always declare constituency, right? I'm a voter in your district. I would love to talk to you about issues related to homelessness. How much time do we have? Okay, and they'll tell you, okay, you have 3 minutes? Okay, 3 minutes. So stay on message. Declare your constituency. I'm a voter. And if you have like 6 or 7 voters, that means you have a more attentive audience, right? Because in the political world, a couple of minutes with a voter in your district is worth X number of dollars of smear campaign television ads. So, and they want to talk to you because they want you to walk away feeling good, feeling good and voting for them. Declare constituency, be very respectful of their time, and be respectful if they disagree, because this is a relationship. And I told Pamela we're going to be doing this, and I said, Pamela, being someone who spends a lot of time in the state capitol here in Salt Lake City, what advice do you have to say? And she said, never sacrifice issues for relationships. That's her lesson, which is very keen. When Steve and I trained in Atlanta. When I was in Atlanta, I did a lot of advocacy work for immigration policy, and I remember talking to all of these state congressmen, and they would disagree with me. But occasionally an issue would come up, and I remember one time I was testifying before the state Congress, and one person from rural Georgia said, I think we should listen to what this young man has to say, because he is always very, very polite and tries to do the right thing. Okay? So at that point, the relationship is now giving me an audience. So even if they disagree, thank them for their time, always be respectful. Have a fact sheet you can give them, because chances are they're going to forget. They got lots of things on their mind, like getting reelected. And also, if you request for an audience and you get one of their aides, don't be dismayed. The political aides run the country in Washington, D.C., as well as in the state government. So these recent graduates, 22 years old, they're the ones that are writing policy. They're the ones that are whispering into their policymakers' ears, vote this way or vote that way. So if you do get an aide, be respectful. Say, thank you so much for your time. I work with the homeless. This is what I saw last week. These are the statistics of what we saw. And this bill that's going before the House, we really feel strongly that this would not be in the best interest of the homeless community or in our general community. So tell them what you see in the world of advocacy. They can't argue with you if you tell them what you see. Last week, I took care of a patient. He told me this, right? That's not open for discussion. That's a fact. That's the best form of advocacy you can do. It's bearing witness. It's saying, you know what? I don't write laws. I'm a doctor. I'm not a politician. But last week, I took care of 6 people with blood sugars over 600 because they lost their job and they lost their health insurance, and now they're homeless and they can't manage their diabetes. And that's just wrong. We as a society have failed them. And as a policymaker, you had a right to know. I did the best I could at managing their diabetes with what I had, but what are we as a community doing for these people? So now you have a nice, short, concise testimony followed by an ask. Education, keep your volunteers educated and articulate about issues, right? Your volunteers, word of mouth is how messages get spread. What's the best restaurant here in Salt Lake City? You know how I know what it is? I asked someone that lives here. So keep people in your organization educated about the issues and about your organization. Every 2 months, we at Doctors Without Walls have Journal Club. We get together, we read one clinical paper, one public health paper, and one policy paper. So that way, when our volunteers are going to their class or they're going home for Thanksgiving and their family says, what are you wasting your time with all those bums? They say, Dad, I'm so glad you asked that question, because we just read a paper about how the economy has affected the working poor, who are people that that have jobs but yet don't pay rent, and there are patients in the park. Okay? Now you're using your own volunteers to stay on message. We have a newsletter. We have run a seminar at a local university. There's lots of ways to keep people informed. Educate your community, public speaking events, schools, churches. Get on radio, get on television. Radio is actually the most popular place that people get their news from, is radio. Second most popular is on their phones or on their tablets. So if you get an opportunity, I remember one time Ryan and Jesse Lee, there was this Community Matters, a radio show, and we got invited to talk about it. And we came in, and boy, did the phones were lighting off the hooks. We were giving them something they hadn't heard before. Okay, it's a tool to recruit donors, volunteers, to gain community support. And in the end, and this is the advocacy. For those of you that are medical students, I'm sorry we in education have failed you. You're not going to learn advocacy in medical school. But we as physicians, we in healthcare do have a responsibility to let the community know what we see and that social justice does affect health outcomes. So Timonage, advocacy. These are the Doctors Without Borders principles. Use proximity, transparency, and integrity to give the people a voice. Bear witness, talk about what you see. One of the most incredible testimonies I ever heard was an OBGYN who worked with women who suffered from gender-based violence in the Congo. And gender-based violence as a tool for war. He got out in front of a very, very hostile audience and said, you know what? In my 4 months there, I took care of this many thousand women who had been raped or had been raped with bayonets as a tool for war. This is how I treated them. The questions from the audience were, don't you think the government should do this? Don't you think the government should do that? His answers were, I'm just telling you what I saw. Okay? That's powerful. That's valuable. You maintain your neutrality. You maintain your access to patient populations. You get the word out so that the advocacy groups can take sides and fight that fight for you. We have a responsibility to get the word out that people are sick on the streets. We're out there taking care of them. And the reason they're sick is not necessarily because of disease, but because of social determinants of health. Use narrative, use data, like we already talked about. If you're going to take a political side, that is a decision that involves more than you. It involves your whole organization. All right, this is an election year. If you're going to come out as an organization and make a press release that your organization supports this bill that supports immigration legislation or supports housing people, that is going to create a political waves. And you need to make sure that your whole organization is on board before you do that. So be clear at the end of the day, it's about the people we serve. Sometimes being about the people we serve is keeping our mouth shut, just taking care of them, just giving them medical care. Sometimes it means we need to tell the world what we see and the world needs to intervene. So some examples, although most people believe that homeless are lazy and looking for handouts, when you look at the evidence, many of the people we see in the park are the working poor living in their car, such as this man I took care of last week, and give your narrative. Last week while I was street rounds, I treated a man and this is what he told me. 11% of the homeless are military veterans in the United States who served our country, such as this guy, and I'm going to tell you about him, okay? Mix statistics with narrative, do it in a way that they can't argue with you. Integrate your communications team with the rest of the organization, right? Have doctors, nurses, social workers, administrative types as part of your communications team because you don't want to outsource this to a PR firm, right? These are advocates, these are members of your organization who are giving your organization a voice. At that, I'm going to turn things over to student Dr. Ryan Nguyen, who we have now sent off to educate Western Osteopathic School on the ways of street medicine.
Okay, thanks again to the International Street Medicine Symposium for inviting us to speak. As I stated before, my name is Ryan Nguyen. I'm a first-year medical student. Prior to going to medical school, I was at UCSB where I served with the communications team, the first ever communications team actually. And what I'm going to be speaking about is how to set up your communications team, because that's basically what I did: recruiting volunteers and setting up all the different things that we did. So learning objectives. If there's anything I've learned in medical school, you can't have a PowerPoint without learning objectives. So here are a few that I have. So determining how a communications team can assist your organization. We do a lot of different things for Docs Out Walls. What are your organizational needs and how can that communications team fill those needs? What are the different roles of the different people on that team? And then finally, how to actually recruit those team members. So why does your organization need a communications team? And when I thought about this slide, it really boils down to two different points for me. Defining, you want a communications team because they will define how your organization tells your unique story of street medicine. Street medicine by itself is already an innovative and a really spectacular idea. I know when I was interviewing at different medical schools, every time I told my interviewers about street medicine, they were blown away, because the idea that healthcare practitioners will go outside of their walls to go directly to people is an idea that really no one has thought of before. And anytime, I'm sure, when any of you talk to anyone in the public, they can't really believe the idea either. So what your communication team does is it takes all the unique aspects of your community and your organization and crafts it into a message that's unique to your organization. And then also it empowers, your team is going to empower your volunteers with data and sound bites. Just like Jason was saying, your volunteers are your most valuable asset in your organization. You can have 3 or 4 communications team members, but if your communication team provides the message and reinforces that message through your newsletter, through your Facebook page, through public speaking events, anytime that someone asks one of your volunteers, why do you volunteer? Your communications team has already given them the message that they can relay, and that way your volunteers, when they're asked that, they can say the message that you have crafted for them already.
With their own individual twist.
Yeah, with their own twist. So here are 4 of the really the most common organizational needs that we've found. Volunteers, there's always a need for volunteers. When I first started with Docs Without Walls, we were looking for more people in the parks, and now 2.5 years later, we have a waiting list that's at least 100 or 200 students long. And the way that we were able to do that was really, we gave presentations to like the local pre-med groups. If we needed more doctors or we needed more nurses, we would give presentations at like grand rounds or things like that. So anytime we need volunteers, we give a presentation to that demographic, and really people just don't know about the organization, and as soon as they find out, they're like, oh, this is great. They contacted us, and then they start volunteering with us. Community support, we collaborate with local organizations. One of the things that I was able to do was an Eagle Scout or a Boy Scout actually contacted us because he wanted his Eagle Scout project to support us. So I worked with him throughout the year to do that project. And then also, like Jason was saying, I had some unique presentation opportunities like the jewelry show. I didn't ever think I'd go to a jewelry show in my entire life, but I guess I can check that one off the list. And then also outreach. This is, I think, one of the most important things we do. We really humanize our beneficiaries just by sharing their stories. Lauren does a lot of this, and she'll talk about the newsletter. We interview the people that we treat, and we share their stories, and when people are actually to see the lives that they've led, they look at these beneficiaries as more than just homeless people. They look at them as actual persons. And then finally, the big F-bomb, funding. Everyone needs more money, obviously, and ever since we've been doing all our online and social media efforts, we've been seeing a lot more increase in funding through donations online, through PayPal, and just having a constant presence on things like Facebook. We update our Facebook page about once a week, and people just see that, and we're always in the back of their mind. So when it comes time, especially around December or January, when the tax filing is coming in, we see a lot of donations online coming that way as well. So the anatomy of a communications team. I really like this picture. One of my anatomy professors put it in his slide, so I stole it. So we have a team leader who, on our team, is Jason, or Dr. Brostowski, and he serves as the kind of the healthcare professional, or as like the mentor in the medical education kind of system. This would be like you're attending. You have a student leader who, that used to be me and is now Trevor, and that is kind of like your chief resident. It's your most experienced student volunteer who will oversee other student interns, and then you have also 2 to 4 other like support student interns who work on individual projects. So your community leader, they need to be established in your organization because this is the person who's setting kind of the tone and is the role model that all the students will be looking up to. They should have a lot of experience in public relations and a passion for mentoring and teaching. Essentially, if you can find another Dr. Brostowski in your organization, that's the perfect person. And really, part of the reason that we prefer that the person is the healthcare professional is because sometimes just having their title brings credibility to your communications team, such as in academic or professional settings, or like when we're talking to government officials, they want to talk to someone with an MD or an RN or some other healthcare professional who brings that kind of credibility to your team. Your student leader, when you're looking for a student leader, you want to look internally within your volunteer base. Look for a student who's really involved, who you can see kind of managing and being that champion that Jason was talking about. Basically, you want a student who you will feel comfortable talking in front of hundreds of people on behalf of your organization. This student's going to be managing schedules, projects, and other people, and again, will also be a strong public speaker. And then your other student interns, you can either, again, look internally within your student organization, within your student volunteer base to find these interns, or you can advertise to, again, the local pre-med groups or pre-health groups to find these people. They should be creative, innovative thinkers. Like Jason was saying, or Dr. Persowski was saying, a lot of what we do is we give ownership of projects to our interns. When I was starting the communications team and I brought on Trevor and Lauren, instead of just delegating individual tasks every week, I just said, Lauren, why don't you be the newsletter coordinator, and Trevor, why don't you be the website coordinator? So instead of them waiting for me to give them tasks every week, they just took off with those different things, and our newsletter is pretty popular. Everyone wants to look at it now. On our website, if you type in street medicine, it's the second or third result above, just underneath the Wikipedia entry for it.
And street medicine.
Yeah, and the street medicine actual website. And again, like I was saying, interns who have specialized skills in writing, editing, graphic design, public speaking, these are really the people that you want to be pursuing. And why would students want to actually do this? Because we don't get paid, and when I was getting paid, it was pennies on the hour. For me, and from my personal experience, it was a unique pre-health experience. I had volunteered in the hospital before, changing bed sheets, and I'll do this a million times to get over that. You get incredible mentoring from a healthcare professional, Dr. Persowski and all the other individuals within the organization, networking opportunities, and of all the volunteer things I did in college, this was the one that I actually felt like I was making a difference. And if you can convey that to the people, the student interns that you're advertising to, they'll jump at the opportunity. And then again, recruiting your comms team. Your two most important, your two key members, your team leader and your student team leader, you want to look within your organization, because those people will be guiding the new interns that you'll be bringing on. Again, reach out to your local health professions association, the AMSA, the medical student chapter, other pre-health organizations. Sell the unique experience, and like any other selection process, applications, interviews, one of the unique things that I like to do when we were selecting interns was, instead of interviewing them, we told them, why don't you come to an interview with us, but you bring a unique project that you would bring to the team. So instead of just doing the regular interview that everyone does, tell them to come up with an idea of their own, because a lot of what comms is about them being innovative and thinking of new ideas, so you can actually see, is the student willing to go the extra mile, do their homework, and actually be creative. And then finally, always be ready for transition. Kind of like the medical culture, where interns and residents will move on. Again, be ready for your students to move on within 1 or 2 years. I just moved on, and now Trevor is taking my spot, and that is what leads.
If any of you guys are on admissions committees at medical schools, let me know, because doing the clinical training is the easy part.
And now this is Trevor Melz. He's the new communications coordinator, and he's a lot better at the job than I am, so I'll continue on.
He's taller.
Okay. So like I said, I'm finishing up at UCSB, and I'll be sticking around with the organization until I apply to medical school. So Ryan taught me that we need a learning objective slide. So I'm going to be going over how to set up a website and what kind of things that you want to put on there, and what kind of things that people like to see on it. What we do with our data and how we compile it and make it available to the public, both patient data and financial. How we brand our organization to the community, to our beneficiaries and our volunteers, and then creating public documents and handouts and reports that you can give out as a physical thing to read. So here's our website. If you haven't seen it, it's santabarbarastreetmedicine.org. And there's this is the homepage. There's a lot of stuff going on. A slider that flips through recent stories, links to our more popular pages. And I'm going to be talking more about how we choose what to put on there and why we choose that, and how that affects donations and volunteers and all that. So let's see. Do these get out of order? Okay, I'm going to go back. So here's just some basic steps to creating a website. You want to identify somebody who's preferably familiar with the doing things online and creating websites or designing them, just so they have somewhere to start. And hopefully that's someone, like Jason said, that's involved with the organization and goes to many of the clinics and knows the volunteers and the leaders in the organization, because without that, you're kind of just outsourcing the work to someone else, which doesn't produce as good of a result. So then you register a domain, you purchase a hosting plan. These are all pretty easy to do. Pick a theme or pay someone to do it, and then fill it with all your content, which is what we're going to be talking about. So really quickly, this is the program we use. It's called Wordpress. We have no affiliation or partnership with them, but it's a free program, and it's worked for us. Some cool things that you can do. You see on there, there's data, so you can see which pages are visited the most. You can see how long people are on those pages. So for us, the average is about 2 minutes, and that's actually pretty good for when you think about online. It's usually closer to 30 seconds or less. So that means we have 2 minutes to get the information we want to whoever's reading our site, which is useful information. These are the kind of things that we post. So when Lauren gets or makes or writes a newsletter article, that will go in some kind of blog post that's under our recent stories and recent articles that get fed out to everybody that's subscribed to our newsletter. We also just have our standard pages that's like about us, contact us, volunteer with us, donate, all of those. So here's some key ones that are our most popular pages or most useful pages, and things that you definitely should look at developing. So about us, really defining the scope and the programs that your organization is involved with. Often, especially at Doctors Without Walls, we have a very grassroots philosophy, and it means that there's a lot of things going on kind of independently with the coordinators of those programs, and having them all together on the website is a good way to define our own organization for ourselves and for the community and beneficiaries. And then you want a way for volunteers to contact you, for members of the community to contact you, and for people to donate. Yeah. And then Facebook, like Jason said, if it's 2012 and if you don't have a Facebook page, you're falling behind. So
and all your volunteers need to like it.
Right. Yeah, so this is very easy to do. And there's other options. There's Twitter or LinkedIn. There are other ways to take advantage of social media. But and it's important to set up guidelines for who's authorized to post on the page and how they do it, or if it's just kind of a duplication of the things you post on the website. Also, interaction with community members. We have certain we've had certain times where people have sort of spoken out, have started debates and stuff on our Facebook page, and
well, we have one bipolar patient who goes to the library and leaves very long replies to our posts. Yeah.
So you can decide you can decide whether you want to censor those things or participate in the conversation, or just kind of let them happen on their own. So and then also another thing that's very useful for any online properties, if you were in Jim Withers' talk, we went over it a little bit, but collecting video or pictures or audio to put on the website, it's what people want to see. So we use a media consent form to protect the patient and make sure that they understand where their pictures are going and whether or not they want to be identified, but also to protect our own organization. And that's that's another strategy that we use with bridging trust and outreach, is to if we've established trust with someone, we can, instead of bridging them to a social worker or a physician, we bridge them to our photography and media team. Branding is important for a few reasons. One, it lets the community know who you are and where you're working, but also like a theme for this conference has been the patient care always comes first, and branding helps the patient identify who you are and where you are. we're often referred to in Santa Barbara as the people with the red backpacks. And that's a way people call us that instead of by our name, because that's how they identify us. So making sure that you're consistent across documents, t-shirts, on the website, all that.
California King's Day?
Does it look like the...
Looks like a California
Red on
King.
black,
I've
red on
never
black.
And then documents, we have a ton of different stuff. We don't have any with us, unfortunately, but brochure, fact sheet, business cards, finance reports, data reports, just informational handouts are all useful at public events or speaking events, and also to inform volunteers and make sure that they're up to date on data and info about the organization. They're giving facts along with their own personal narratives. And then, so as we develop, we've had our current website going for over 2 years now, and we're able to analyze, what pages are visited most, which is very useful for seeing where to sort of invest your time in developing these.
And one of the really quick things about that is you can check which of your pages gets the most visits, and you have one page like the About Us page that gets a ton of visits, more disproportionately than any other one. You put more links in that one to donate, to volunteer, so that when people spend a lot of time on that, they see those other links and they'll go to those other pages you want them to go to.
And then Jason talked about transparency a little bit, but I think it's important when you have this data and you're reviewing your charts and compiling them, that just doesn't go to the grant writing committee and go in some long grant report, but it goes out to the community and to the beneficiaries and to the volunteers, so that they know what we're doing, where our money's going, and what the tangible result of that is. So we've spent a lot of time getting as much out of the data as we can. Sometimes it's hard to compile it after the fact, but here's some examples. This is our finance report. You can download that on our website. These are some graphs that we've compiled for 2011, things like the age of our patients, their chief complaints, how many years they've been homeless, and again, this is another thing that you can utilize students and interns, since it's it can be a lot of work to go through a year of data, so a good way to get them involved. And then I'm going to skip this in the interest of time and hand it over to Lauren.
I'm Lauren. I've been with the communications team for about 1.5 years, and I've been managing their newsletter during this time. This is kind of a little overview of our newsletter. Try to make it fill on one page. And these are our objectives for our newsletter. Our newsletter does a lot of things. We use it as a form of advocacy. We use it to tell stories of members in our homeless community. We use it to talk about our volunteers, and I'll go through some of these other stories with pictures. The most important aspect of our newsletter and our most popular articles all involve the stories of members of our homeless community. A lot of people generalize about the homeless when they think of them as a population, but when you talk to the people that are homeless one-on-one and you really hear their story and hear what they've been through, it changes a lot of people's perception of the homeless. And this is a huge deal for us. We really want to humanize the people that we work with. And yeah. Another thing that we do with our article is we highlight our volunteers. I work with some amazing individuals, but beyond that, we're not saints. We all have day jobs or go to school. We're just people that volunteer our time because we want to help our community. And by putting that message across, we attract more volunteers because we show that anyone can do this, anyone can get involved. We're people that just want to get involved with street medicine and make a difference. Another major aspect that we put in all of our newsletters are recent accomplishments. We want to make sure that our members know what's going on with our organization. We also want to make sure that our donors know what's going on, people that have left, like Ryan, that left, so he still knows what's going on with our organization. We recently had our first benefit concert, which is in this picture, and we have an underserved medicine class, MRC, and we provided medical care at a foot washing event during Easter time. Another thing that we do, as Jason talked about earlier, is advocacy. We'll interview local politicians and put their stories in our newsletter. Doss Williams is our juryman?
He's our assemblyman.
Assemblyman. And Ryan interviewed him. But he used to be homeless himself. He used to live in his car when he went to school, and he was homeless himself. And by telling these local politicians what we see, we're able to advocate for our population that we try to help. We also share talents of many of the members in the community. This is Mark. Mark's an amazing poet, and we publish some of his poems in our newsletter. Kendra, she comes to the women's clinic, and she does amazing work with crocheting, and she actually taught a class at our women's clinic to other volunteers and women that are homeless and taught them how to crochet, and just did amazing work. And the people that are in our community are just extremely talented, and it's such an honor to be able to share their stories with other people and their amazing work. We also highlight other organizations, Jim and Valerie from the Waikiki, and everyone knows Jim Withers, but they were able to talk about their organization so we could show our readers that street medicine isn't something it's unique, but it's not something that we're just doing in Santa Barbara. It's a growing movement, and we're going to inform them about what's going on with street medicine in other places. And just like Trevor said earlier, we don't have any invested interest in Mailchimp. We don't have any stock with them or anything. But this is a program that we use for our newsletter. They have a free version. There's also one if you want to expand a little bit. That's $10 a month. It's pretty reasonable. And we used to do our newsletter bi-monthly, but now, or monthly, now we've moved it to bi-monthly. And the reason we did that is consistency is extremely important. We want to make sure that we publish at the same time and readers know when to expect it. And another great thing, if any of you are interested in starting a newsletter, there's videos on their website on how to use all the technical aspects. So I need to spend a bunch of time up here explaining the technical details of how to use the program. And a great thing about Mailchimp is it's an electronic newsletter. It's sent out through emails, and we can use it as a way to link all of our forms of media. We have links to our Facebook page, to our website with the articles, to our donate button, and to other organizations. So when they read the articles, if they're interested, they can click and donate and get more involved, and it just brings together all of our different forms of media that Trevor was talking about earlier. And then I just wanted to go through one of our newsletters. I'll do it pretty quickly for the sake of time. Like I said, here's the different media buttons. You can donate, you can friend them on Facebook, and this is just, that's kind of the point of the title page. We also have an intro every month. Jason writes our intro, and we pick a theme for each newsletter, and we tie together all of our different articles in the intro. And here's our different articles from our most recent newsletter, and we usually have between 4 and 6 articles. And some very important details, I can't stress this enough, make sure that when you're interviewing patients that you get their permission to publish their articles and they understand that what's going to happen with their stories that's being published, who's going to read it. Because we put so much time building trust with our patients, we never want to break this trust by sharing their stories when they didn't want that to happen.
Just verbally, or?
Verbally, yeah. And we also, if we take pictures, we have that media consent form. But I always go into a lot of detail telling them, you know, these are the people that are going to read it. And it's always people that we've already built trust with that we know really well. We don't want to exploit this population, or the people that we help. And whenever possible, I always try to bring the article back to them and have them read the final version to make sure I didn't misquote them at any point, to make sure that they're telling their story the right way. And we also work to find volunteers who are willing to write articles. So we have a variety of authors and have an editing team and a photo data bank, such as Paul, so that who edits and takes photos, so double talent. But finding people like that, and hopefully they're part of the organization as well, so we can, you know, that thing of keeping everyone in the organization. And we also get feedback both in person and through our newsletter. Get through. These are our details from our most recent newsletter. We have a pretty high, compared to the industry average for nonprofits, we have a pretty high percent of people who are actually opening the newsletters and then clicking on the links. And then on top of that, with this program, we're able to see which articles are clicked on the most, what percentage of people, and overall we have a very high average. I'll probably skip through these just for the sake of questions, but we do a lot of public speaking, and the main thing is we want to make sure that our comms interns are really involved with the organization. I attend the women's clinic, I go to the parks, I go to all of that because when I'm speaking to people with a lot more experience than myself, especially at an international symposium of street medicine, people have a lot more experience than me. I can't say that I'm an expert on homelessness. I can't say that I know more than, well, most of the people here, very on the bottom. But I can say what I see, and I can see that last week I saw a woman at our women's clinic that was fleeing domestic violence. So I can see what I've seen, and no one can argue with that. Like Jason said, the power of bearing witness to what we see and using that as a tool. And do you want to have your final thought?
Yeah, so just in conclusion, because we still have a few minutes for questions,
Yeah.
just take this off of you here so that we can support the documentary. So real quick, I used to watch Jerry Springer, so he always ended in a final thought. I always thought that was cool. Having a dedicated communications team does help your organization and helps manage public perception, which is important because we all know that we do great work every day, every week on the streets, but it's important that other people know that we do great work as well. Advocacy and bearing witness, we have a responsibility to advocate for those people we're serving, not just provide them with medical care, but provide them with a voice. Many of us do great work. We're not very effective or adequate or very good at portraying the good work that we do to potential volunteers, to donors, and the community. Sound bites, if that's all you get out of this, sound bites, that's a sound bite. Journalists are our potential friends, so make sure that you understand the rules. And using a diversity of approaches, we can have impact not only on treating patients, but we can really use our unique relationships that we've built and our proximity to give these underserved populations a voice. This is an example of a soundbite testimony. This is a colleague of mine from Doctors Without Borders. He said, "We suture, we record the events, we tell the world we struggle daily with private thoughts of whether or not we make a difference. The ultimate solution may be political, anonymous, and nebulous in some remote conference room, but I've seen the blood, the people cry in pain, and the people laugh with hope, and I know we need to be there. You don't have to be working with a refugee population. It holds true with our communities that we serve." And at this point, you have 3 communications experts right here and who are ready to answer your questions. So thank you. So Matt, you had your hand up there?
Thanks.
You want to come closer here so we don't have to yell over all these people?
Yeah, I just had to plug in.
Oh, okay.
I had it all day.
Your computer's safe. No one's going to steal it, I don't think.
Oh no, but I just
These look like really respectable
I got to
people.
take all these notes from all these great sound buttons. Can you tell me specifically who does your web design, and more generally, what are the nuts and bolts of recruiting all these great volunteers and interns that you guys got in your organization?
Do you want Trevor and Ryan? You guys want to take a stab at that?
Yeah, I'll take the first part. The design, the actual layout of the website was a template. You purchase, for the program that we use, you purchase templates, and then you just kind of fill them in with pictures and customize it in small ways. So we didn't hire anybody to do the design, we just filled it with content.
You are patching and updating WordPress. It's known to get attacked by hackers. You're accepting funding.
Right. Yeah, we are keeping it up to date. Yeah, because there are some things that need to be secure on there.
And then for the second part of the question, basically like I was saying, when I did the interviewing process, I really tried to look for people who were motivated and wanted to do things on their own without being told what to do every week. So I think one of the really important things that we did when we were selecting people was telling them to come up with their own project, like a project proposal, instead of an interview process. So that way I can see, are they really researching our organization? Do they know kind of the lingo that we're speaking, and what kind of unique skills do they bring to the table? So when Trevor interviewed, I saw in his resume that he had website design, a little bit of kind of graphic design experience, so that's kind of where we pushed him to go. And then Lauren had a lot of great editing and writing experience, so that's kind of where we pushed her to go. And obviously students aren't going to be experts at making newsletters and making websites when you first get them, but if you kind of just push them in the right direction, they'll really take off with it if you give them the freedom to.
And to add on to that, I think, Matt, you missed our first workshop where we talked about our philosophy towards managing volunteers. Is in general, we as an organization invest in the volunteers and invest in us. and the communications team is no different. You know, I get asked to do a lot of public speaking locally and regionally, and I always tell them that, okay, if I'm going to come speak, then one of our interns is also going to speak and have part of the lecture, because it's important for our communications interns to get experience doing public speaking and advocacy. So when I meet with political leaders, the students get experience with that as well. And you know, that's kind of part of it, is the fact that you know, a lot of people are really enthusiastic and passionate about volunteering, you know, on the communications team or with the organization, because we believe in fostering the education in our volunteers. So it's win-win. And ultimately, the goal is that the patients receive the benefit.
And I know some people in the admissions committee of University of Pittsburgh.
Hook you up in Emory.
You mentioned the women's clinic.
Yes.
That's physically within your clinic, or is it a
So our
separate?
women's clinic, they're
There's gonna be
presenting
a poster
tomorrow
presentation
with the
tomorrow,
poster
yeah.
presentation. They are doing a poster presentation tomorrow, but I also volunteer at the women's clinic, and that is our only indoor clinic. We use a transition house the second, third, and fourth Friday of the month, and it's a very interdisciplinary approach. We have acupuncturists, podiatrists, we have the nurse practitioners, and we have showers there and food and clothes, and it's a very comprehensive approach to health. And they're going to be talking about it a lot more tomorrow.
I think their poster is just right
Their
out there.
poster is still be up as well.
Yeah.
And you can go to our website.
And you can also all sign up for our newsletter, which is on our website as well, which should be coming out next week.
You can like us on Facebook.
You can like Doctors That Wall, Santa Barbara Street Medicine on Facebook.
I just liked you.
You know, one of the things that this kind of started out of a real, very obvious deficiency that we had in our organization. And once the deficiency was acknowledged, it really expanded in a very healthy pace, because, you know, websites and writing, and, you know, and this is things that we all already know and already do. We just haven't been doing it for the cause. And it's something that you know, our ask at the end of this presentation, you know, is, you know, because we always end every public speaking, and our ask is, you should start a communications team and find a way to really advocate for the people you're serving and for your organization, because it's healthy and it's something that everyone benefits from.
Sounded more like a tell.
That's it. You're right.
Well, I'll tell you
You
what,
put that in the
we'll
question.
see what you do next, and let history decide. Any other questions, comments, any feedback for our student interns?
Great job, guys.
You guys come off very professional and polished. I love it.
We got matching shirts too. Ryan forgot his.
Except for me.
Yeah.
We're all
Part of
there.
our branding.
Yeah, but we sent them to medical school now, so we knew that they were going to unlearn a lot of the stuff we taught them.
Yeah.
How do you find such good, bright students?
They
You
found
know?
us.
I mean, because obviously there's going to be those students that, so they found you.
Well, I mean, part of it, all of us were in an underserved medicine class that was put on by Doctors Without Walls, and that's how I found out about the organization. And I don't know if I was as motivated before, but I was definitely motivated. But I think that it's so inspiring, the people you work with. So it kind of, you know, being around people that inspire you, that are working hard, you want to work hard. And, you know, Jason puts so much trust into us. The newsletter is something that, you know, I pick the dates for, and you feel like you're responsible for it, and you feel that they're holding you to a certain standard, and that really pushes you to work harder. And it's such a great experience. Like, you know, I didn't get paid like those guys, but I would do it a million times over. I should have gotten those pennies on the hour. But
One of the things that we're really lucky in Santa Barbara in the geography is we're right adjacent to a really wonderful university. And we've sponsored a course. It's an underserved medicine seminar. Jim Withers and Jim O'Connell are speakers for it every year. We bring in speakers from all over the world who talk about care of underserved populations. The goal of the course is to show unconventional careers dedicated to underserved communities. And by the end of the course, all of these students would all want to go off and and go to Africa and save babies, they realize that the principles of working with undocumented immigrants and the homeless and refugees and veterans and Native Americans, it's all the same principles at heart. And what we do is we have the best and the brightest in that class. They join our student arm, which is Street Health Outreach, which is undergraduate students that go out with the homeless and give out socks and create relationships. And then the best of those, we cherry pick into our organization. So we kind of have like freshman, junior, varsity, and varsity.
Okay.
So we're cheating a little bit.
Yeah, there had to be a way.
But a lot of you probably are adjacent to medical schools or adjacent to undergraduates, and those relationships are so valuable because these students, they want to learn and they want experience, and they're starving for mentorship. And all we do is sit around and complain about how, kids these days don't learn anything and what's wrong with the schools. And but what you can do is become part of it, and then all of a sudden, just wonderful things happen. And if any other questions, this is Taylor, our volunteer coordinator, and Allie used to be the head of Street Health Outreach. You see people wearing these shirts, they're our volunteers, so go ahead and give them a hard time, test and make sure that they know their stuff. So I think that's 5 o'clock. So
Thanks, guys.
hey, thank you guys.
Thank you.
Okay.
You're always on the record.
Yeah. Sure. Give